Man's Search for Meaning, page 20. I think it was Lessing who once said, "There are things which must cause you to lose your reason, or you have none to lose." An abnormal reaction to an abnormal situation is normal behavior. Even we psychiatrists expect the reactions of a man to an abnormal situation, such as being committed to an asylum, to be abnormal in proportion to the degree of his normality. The reaction of a man to his admission to a concentration camp also represents an abnormal state of mind. But judged objectively, it is a normal and, as will be shown later, typical reaction to the given circumstances. These reactions, as I have described them, began to change in a few days. The prisoner passed from the first to the second phase, the phase of relative apathy, in which he achieved a kind of emotional death. Apart from the already described reactions, the newly arrived prisoner experienced the tortures of other most painful emotions, all of which he had tried to deaden. First of all, there was his boundless longing for his home and his family. This often could become so acute that he found himself consumed by longing. Then there was disgust with all the ugliness which surrounded him, even in its mere external forms. Most of the prisoners were given a uniform of rags, which would have made a scarecrow elegant by comparison. Between the huts in the camp lay pure filth, and the more one worked to clear it away, the more one had to come in contact with it. It was a favorite practice to detail a new arrival to a work group whose job was to clean the latrines and remove the sewage. If, as usually happened, some of the excrement splashed into his face during his transport over bumpy fields, any sign of disgust by the prisoner or any attempt to wipe off the filth would only be punished with a blow from a capo. And thus the mortification of normal reactions was hastened. At first the prisoner looked away if he saw the punishment parades of another group. He could not bear to see his fellow prisoners march up and down full hours in the mire, their movements directed by blows. Days or weeks later, things changed. Early in the morning, when it was still dark, the prisoner stood in front of the gate with his detachment ready to march. He heard a scream and saw how a comrade was knocked down, pulled to his feet again and knocked down once more. And why? He was feverish, but had reported to sickbay at an improper time. He was being punished for this irregular attempt to be relieved of his duties. But the prisoner who had passed into the second stage of his psychological reactions did not avert his eyes anymore. By then his feelings were blunted, and he watched unmoved. Another example, he found himself waiting at sickbay, hoping to be granted 2 days of light work inside the camp because of injuries or perhaps fever. He stood unmoved while a 12-year-old boy was carried in who had been forced to stand at attention for hours in the snow or to work outside with bare feet because there were no shoes for him in the camp. His toes had become frostbitten, and the doctor on duty picked off the black gangrenous stumps with tweezers one by one. Disgust, horror, and pity are emotions that our spectator could not really feel anymore. The sufferers, the dying and the dead, became such commonplace sights to him after a few weeks of camp life that they could not move him anymore. I spent some time in a hut for typhus patients who ran very high temperatures and were often delirious, many of them moribund. After one of them had just died, I watched without any emotional upset the scene that followed, which was repeated over and over again with each death. One by one, the prisoners approached the still warm body. One grabbed the remains of a messy meal of potatoes. Another decided that the corpse's wooden shoes were an improvement on his own and exchanged them. The third man did the same with the dead man's coat. And another was glad to be able to secure some, just imagine, genuine string. All this I watched with unconcern. Eventually I asked the nurse to remove the body. When he decided to do so, he took the corpse by his legs, allowing it to drop into the small corridor between the two rows of boards, which were the beds for the 50 typhus patients, and dragged it across the bumpy earthen floor toward the door. The two steps which led up into the open air always constituted a problem for us, since we were exhausted from a chronic lack of food. After a few months' stay in the camp, we could not walk up those steps, which were each about 6 inches high, without putting our hands on the door jambs to pull themselves up. The man with the corpse approached the steps. Warily he dragged himself up. Then the body, first the feet, then the trunk, and finally, with an uncanny rattling noise, the head of the corpse bumped up the 2 steps. My place was on the opposite side of the hut, next to the small sole window, which was built near the floor. While my cold hands clasped a bowl of hot soup, from which I sipped greedily, I happened to look out the window. The corpse, which had just been removed, stared in at me with glazed eyes. 2 hours before I had spoken to that man. Now I continued sipping my soup. If my lack of emotion had not surprised me from the standpoint of professional interest, I would not remember this incident now, because there was so little feeling involved in it.